Hi, my name's Lori Jones, and I am a urologist with Partners in Urology. I graduated from the Medical University of South Carolina in Charleston and completed my residency in urology at University of Medicine and Dentistry of New Jersey and Hackensack University Hospital. As a urologist, I treat diseases that affect the urinary tract, so this includes the kidneys, the ureters, and the bladder. Both cancer conditions of any of these organs, as well as benign conditions like kidney stones, pelvic organ prolapse, sexual dysfunction, as well as overactive bladder. In my practice, I focus largely on female voiding dysfunction. This often involves treating things like stress incontinence, often with a midurethral sling. I also treat pelvic organ dysfunction, which may involve cystocele repair, either primarily or with a mesh. I also treat patients with overactive bladder or urinating too frequently. Sometimes this is medication management, others we use things like a sacral neuromodulation or InterStim, and perhaps Botox. I also treat patients with vaginal lubrication issues or dyspareunia, meaning pain with sex after menopause, and sometimes we use platelet-rich plasma or the O-shot to treat these patients. One of the great things about my practice is that I can treat patients both young and old. I recently treated a patient in her 50s, extremely active, that told me that after having the combination of O-shot and Femilift laser for stress incontinence, she was finally able to go back to boot camp without embarrassment or worry about leaking during the really intense parts. So allowing her to get back to her active lifestyle was really gratifying. As a female in a largely male-dominated specialty, some of my both male and female patients have told me that they feel more comfortable discussing some potentially awkward topics with a woman. So that's been great to be able to offer that as just one more way to help patients access the care they need for their urologic complaints. My philosophy of care is to treat the patient rather than just treating the problem. I like to use the tools that I have, which may involve surgery or maybe just medications, to really address the whole patient and come up with a solution that improves their overall quality of life. Moving forward, I'm really excited to continue approaching my patients' overall pelvic health and offering them improved technology to treat their existing conditions. I'm excited to offer treatments for stress incontinence and pelvic organ prolapse that don't involve mesh, as well as the newest technologies to treat overactive bladder without medication.